If you are preparing for DHA, MOH or HAD, then this video can save you at least 10 marks because I am going to explain the most important topic, and this topic includes at least 10 marks, and it will save you a lot of time and a lot of hassle. So watch till the end. If you don't know me, I'm Dr. Anik with Health Toes, and I'm going to explain the most asked antibiotic questions which are mostly repeated in DHA. Make sure you know these antibiotics by heart. You have to memorize them, and since I will be explaining 5 of them, so you will definitely know which antibiotics are best to make sure that they are memorized. So as you know, amoxicillin and clavulanic acid combination is mostly available in augmentin, and augmentin, as you know, it is the best for respiratory infections and many more infections that can be cured using this antibiotic. It is safe in pregnancy, and but of course none of this is recommended for any kind of pregnancy. You have to of course go with your health professional. One thing that is most important to remember and memorize is the common side effect, and that common side effect is GI disturbance. So the second one is azithromycin, and as you know, azithromycin comes under macrolides, and this antibiotic has long duration of action because 500 milligrams is recommended once a day, and we have to make sure that the therapy, it should be from 3 to 5 days. It is recommended by guidelines, and one should know that this antibiotic is basically used for many purposes, such as respiratory infections as well, because now what we are facing in Pakistan, and these infections are basically immune to, or somewhat cefixime is not working on them. So we are for the time being the drug of choice is this antibiotic because of the long duration of action, because it is given once a day for adults, and if you are using 250 milligrams, then you have to go for 2 doses per day, that is PID, once in the morning and once in the evening. The most common side effect we face while using this antibiotic is QT prolongation, and as you know that QT prolongation is it can become somewhat very serious, and one has to make sure that if someone is having a heart disease or any kind of problem related to heart, so antibiotic azithromycin is mostly avoided in that patient. Okay. So the third drug is the most common, as you know already. It's ciprofloxacin, and ciprofloxacin is a drug of choice for UTIs, for various kind of infection, including ear infections, or even some kinds of skin infections are also treated with this. And one thing should always be kept in mind while using this antibiotic is we have to make sure that the patient is not pregnant, and although this antibiotic has been used in some scenarios, but we have to make sure that the benefit and the risk analysis ratio should be conducted, and likewise the decisions should be taken. Number 4th is vancomycin. Well, this antibiotic is the most favorite for MRSA patients because once methicillin resistance has been developed by the microorganism, so this becomes the drug of choice to cure such infections. And speaking of the side effects, if it is infused very fast and the infusion rate is quite fast, so it can cause Redman syndrome. And likewise, TDM is also required while using this antibiotic. Fifth is metronidazole, and as you know, metronidazole, also known as Flagyl, it is a multinational brand, and Flagyl is also used for various kind of infection curement, such as GI infections, because this antibiotic is stable at acidic pH. So as we already know it, so metronidazole is the drug of choice for GI infections, including diarrhea, dysentery, and other kinds of infections as well. It is also used for amoebiasis and other kinds of infection that affect your stomach and intestines. And the most common side effect, it can be denoted by this M, is metallic taste, and metallic taste is the most common side effect that comes when a patient is using this antibiotic. I have written these MCQs in short form, and I will read them out to you, and I will write them in the description. So if you are feeling any kind of confusion regarding the MCQ, so it will be explained likewise. So please open the description and read the question by yourself. I will read it to you myself also. So a question arises that a pregnant patient diagnosed with UTI, okay, and the patient is in her second trimester. So which antibiotic is safe? We will read out the options: ciprofloxacin, amoxicillin, doxycycline, and sulfamethoxazole. So the correct answer is amoxicillin, because doxycycline carries a teratogenic defect side effect, and it can cause teeth and bone deformities in the baby, so in the fetus. Ciprofloxacin is mostly avoided. So question number 2, or MCQ number 2, is patient on azithromycin is facing certain effects, and that are palpitation plus dizziness. So what is the likely cause? A, hyperkalemia, B, drug interaction, C is electrolyte loss, and D is side effect. So the correct answer is side effect, because as we know already that azithromycin has a certain side effect of QT prolongation. So the next question is, Redman syndrome is commonly associated to which drug? Let's read the choices that we are given: A, rifampin, B, erythromycin, C, vancomycin, and D is clindamycin. So as we discussed earlier, that vancomycin is the drug that is good for MRSA, methicillin resistant Streptococcus aureus, and for this infection vancomycin is mostly used, but we have to make sure that we do the TDM, and we have to make sure another thing, and that is, if we go fast with the we have to make sure that if we go fast with vancomycin at infusion rate, so it will cause what? Redman syndrome. And in order to avoid this Redman syndrome, we have to make sure that the infusion rate is slow. The clinical questions, which are very long, actually have a very decent trick, and this trick is, you always go for the answers first. always read them first. Okay, you will follow the first, second and third step. Okay, so the first step is read the choices that you are given, and once you are done with them, read them twice if you have to. But the second step is memorize or understand this. So this is the second step. Okay, this is the first one and this is the second one, and in second step we understand what is the question. If you understand the question, let me tell you that your half of the war is done with this MCQ, and no matter how long the MCQ is, if you follow these steps, first read the answers, then read the question, understand it, read it twice if you have to, and then skim the upper available material. So let me know how do you feel about this board. And I was just actually feeling nostalgic while writing this, because when I was a child and I was actually going to school, then I saw students, but I made it myself, and it was a very good experience while making it. Anyways, we will meet again, and if you have any kind of questions, comment down, and if you are looking for coaching classes, then definitely contact me, and I will get that arranged for you, because coaching classes are very very necessary, and you will come to know of it when you failed your exam for the first time. But anyways, study hard, work hard, and smart as well. We will meet again definitely. See you guys, take care, bye.